Tinnitus, commonly known as ringing in the ears, can be an incredibly frustrating experience. Approximately 15 to 20% of the population experience tinnitus symptoms, such as buzzing, ringing, or hissing. If you're one of them, you've clicked on the right video. In this video, you'll learn about the 5 main causes of tinnitus, how to prevent them, and effective strategies and advice for tinnitus relief and treatment, so you can reduce hearing loss and that annoying sound. First, you'll learn about the causes of tinnitus and how and where it can develop. Keep in mind that without understanding the common causes of tinnitus, your symptoms could get worse, so this part is crucial for tinnitus relief and prevention. So, without wasting any time, let's jump right in. So, the first major cause of tinnitus is exposure to loud noise. Noise-induced hearing loss is very common, and it can lead to it either gradually or suddenly. Some common sources include work environments, sporting events, concerts, and loud music in headphones. Loud machinery, saws, firearms, and prolonged exposure to loud music also increase the risk of tinnitus. The best way to prevent this is to limit exposure to loud noise and use ear protection. For safer headphone use, there's the 60-60 rule. Set your music to 60% of its maximum volume and listen for no more than 60 minutes per day. This reduces your risk of developing tinnitus. The second major cause of tinnitus is poor circulation, high blood pressure, and certain chronic conditions. Conditions like atherosclerosis, hypertension, and malformed or kinked blood vessels can cause tinnitus or make it more noticeable. Additionally, chronic conditions such as diabetes, thyroid disorders, migraines, anemia, and autoimmune diseases like rheumatoid arthritis and lupus have also been linked to tinnitus. The solution is adopting healthy habits, such as regular walking, a nutritious diet, quality sleep, and avoiding harmful habits like stress, junk food, and smoking. The third common cause of tinnitus and hearing loss is certain medications. Usually, higher doses of specific medications can worsen tinnitus symptoms. Medications such as non-steroidal anti-inflammatory drugs, which are ibuprofen, naproxen, and aspirin, for example, and certain antibiotics, cancer drugs, water pills, diuretics, antimalarial drugs, and antidepressants are all known for developing and worsening tinnitus. The best way to prevent medication-induced tinnitus is to be aware of the potential side effects of the drugs you're taking. If you noticed that a medication is worsening your tinnitus, consult your doctor about possible alternatives or dosage adjustments. Additionally, never stop taking prescribed medication without medical guidance. Staying hydrated, maintaining a healthy diet, and avoiding unnecessary overuse of pain relievers like ibuprofen, naproxen, and aspirin can also help reduce the risk of tinnitus. The fourth cause of tinnitus is ear infections and earwax buildup or buildup of foreign materials like dirt. Ear infections can cause fluid buildup, which makes your ear canals blocked, just like earwax or dirt. A blockage can change the pressure in your ear, which can lead to tinnitus. Maintaining good ear hygiene can help here, but just avoid using cotton swabs because they can push wax deeper into the ear canal, which can harm. Instead, clean your ears with a warm washcloth or use eardrops to soften the wax. Keeping your ears clean and dry can significantly reduce the risk of tinnitus caused by blockages. And the last main cause of tinnitus is head or neck injuries. These injuries often cause tinnitus in only one ear. If you've had a recent injury and noticed ringing in your ears, consider consulting a doctor to check for any potential issues. Now that you've learned about the causes of tinnitus and how to prevent them, it's time to know how to treat tinnitus and learn practical tips for tinnitus relief. The 5 causes that you've learned are very important because without preventing them, you can only worsen your symptoms. Tinnitus sound therapy is one of the most effective strategies for tinnitus relief. It manages tinnitus by using external sounds to reduce the perception of ringing in the ears through methods such as white noise, nature sounds, or soft music. It trains the brain to focus less on tinnitus, and it masks the ringing, making it less noticeable over time. To use it, you can try white noise machines, apps, or calming background music, especially in quiet environments. The next thing that can help with relieving tinnitus is hearing aids. Hearing aids increase external sounds, so tinnitus becomes less noticeable. They aren't necessary, but if tinnitus comes with hearing loss, then hearing aids can be a very effective solution. And things like meditation with relaxing sounds, preventing the main causes of tinnitus, eating right, avoiding loud sounds, sleeping well, and overall being healthier are habits that will not only help you relieve tinnitus symptoms, but also make you feel better and forget tinnitus. And here's the bonus tip: avoid complete silence. Tinnitus is more noticeable in complete silence, so always have some soft background noise. If you don't avoid silence, it will be harder for you to get used to the tinnitus sound. And that's it for this video. If you found it useful, like this video and share it with someone who might need it. Subscribe to my channel for more valuable content, and comment down below if this video helped you. Goodbye.